Tired of constant sinus infections, pressure headaches, and that annoying stuffy nose? You're not alone. Sinusitis affects millions of people every year, especially in communities where healthcare access is limited. But what if I told you that there's a simple, affordable ways to prevent and treat without always needing antibiotics? I'll break down what causes sinusitis, how to treat it naturally or with medications, and when you actually need to see a doctor. Plus, if you want my free sinus health guide, comment newsletter below and I'll get that to you. Let's clear things up. Literally, sinusitis or a sinus infection is when your sinus passages get swollen or filled with mucus. It can be acute, which is less than 12 weeks, or chronic, lasting more than 12 weeks. Symptoms include stuffy or runny nose with thick mucus, facial pressure or pain around the eyes, nose, or forehead. You can also get upper teeth pain, headaches, bad breath. Yes, your sinuses can do that. Postnasal drip, which is mucus running down the back of your throat. If this sounds familiar, drop a yes in the comments. If you ever had these symptoms, what are the real causes of sinusitis? So number one, viral infections. Most sinus infections do not need antibiotics. They usually come after a cold or go away on their own. Bacterial infections, these last over 10 days and may need antibiotics like amoxicillin. And the last one, allergies and pollution. Dust, mold, and pollen can cause chronic sinus problems, especially in low-income communities with poor air quality. If your symptoms last over 10 days and include fever, facial swelling, or vision problems, please make sure to see your doctor. How to treat sinusitis at home. Steam inhalation. A hot shower or a bowl of steaming water with a towel over your head can clear nasal congestion fast. Saline nasal irrigation, so neti pots or saline sprays, flush out mucus and bacteria, but make sure to use sterile water. Hydration and rest. Drinking plenty of fluids helps thin out mucus. Natural remedies, so ginger, turmeric, and honey, have anti-inflammatory properties. Which one have you tried? Comment below. When to use medications? Antibiotics only if symptoms last over 10 days and are severe. So first line is actually Augmentin. Intranasal corticosteroids help reduce inflammation, good for chronic sinusitis. Saline irrigation and decongestants keep your nose clear and relieve symptoms. Overusing antibiotics can lead to resistance. Please don't take them unless you're prescribed. If you have chronic sinus infections that don't go away with treatment, or if you have severe pain, swelling, or vision problems, you need to see an ENT specialist. Typically, a CT sinus scan is recommended. Doctors are now using biologics to treat severe sinusitis with nasal polyps, cutting-edge stuff. Biologics are derived from living organisms or their components. They are typically proteins such as antibodies, cytokines, or growth factors that are produced using biotechnology techniques. Sinusitis doesn't have to control your life. Now you know what causes it, how to treat it naturally, and when to get medical help. Comment below what's your go-to remedy for sinus infections. Let's start the conversation. Share this video with someone who needs it.